Hello everyone, it's Carmelia Ray here, and I am with the founder, Lana Kerr, the CEO and founder of
Loomis Skincare.
Loomis Skincare. And today we're showcasing two of her flagship products. And I am going to try this. I know that a good friend of mine recommended this to me, and I am excited to get my hands on it and also try something for the female region. So with that said, can you share a little bit about yourself and what you brought here for us today?
So, thank you so much. I'm so happy to be in front of your audience today. We're talking about the CO2 Lift. It's the first Carboxy gel on the market. Carboxytherapy is a treatment. It has a very long history. It started back in the 1100s with the Japanese, where the samurai warriors would bathe in the carbonic hot springs after battle to quickly heal their wounds. Then fast forward to the 1800s, the French developed an application where with a needle, they would put CO2 gas into the skin. And then now more recently in the 2020, where we are now, the Japanese developed a gel delivery system. But just to reverse, carboxytherapy is the therapeutic use of carbon dioxide gas to rejuvenate or regenerate the skin. It happens very quickly. It's the fastest way to skin regeneration.
At my age, I'm over 50, and I've worked with a lot of beauty brands and influencers. I'm so shocked that I've not heard of Carboxy or this carbon therapy. Why is that? Is this new? Am I late to the conversation? Tell me more about it.
Actually, no, you're not. Because when we launched back in 2016, we started with physicians. And truly, it was an educational, it's a new category in skincare. The reason for that is because the only delivery system before the gel was a needle. So you think of it as a painful application.
Right.
It's not FDA approved to be done here in the United States. So it's painful. There's a little bit of a recovery time, but then the results are so impressive. So now to have a delivery system with a gel, an easy to apply gel, it's just information for people. But I think what people resonate or connect with more is the fact that if you think of Carboxy more like a hyperbaric oxygen chamber, people get that better. Yeah?
Yeah, hyperbaric chambers, first of all, typically are not accessible to everyone. And tell us a little bit about that to begin with as a comparable.
Okay, so oxygen therapy, when you think of that, okay, so what do people use it for? They're using it for, after surgery, possibly if they have a vascular occlusion, they're going to go inside of a hyperbaric oxygen chamber because oxygen is very healing.
Right.
Oxygen is...
So they're surrounding themselves with oxygen. They're in that chamber, and we know, just like water, it's filling us up with good nutrients, and oxygen does the same thing.
Exactly. So when you use CO2 gas, carbon dioxide, it naturally will trigger a response in the body to rush oxygen-rich blood to whichever area is applied.
Okay. So the science, is it this box right here?
Yes.
Okay, so what do you get in this CO2 Lift Pro? Because on the box it says face, eyes, neck, body. What's the best use case for this, and how fast can someone get results? It's not just for women, correct?
Correct. This is for anyone with skin. And it doesn't matter.
I have skin.
And it doesn't matter what age. In fact, you can be, we have babies who have eczema, for instance. They use the CO2 Lift on it. So when you open it, it's 2 packets. When you mix it, it forms a gel. And that is applied to any area of the body.
So there's a chemical reaction between the two products.
Correct.
That's creating the CO2.
Correct.
And people want carbon dioxide out. They get these carbon dioxide credits, but we're putting it in.
Yes.
Okay.
Because when you put it in, the body now has to rebalance itself.
Okay.
So you think about when you go, for instance, to a doctor's office and you get laser, some type of energy-based device. You're actually damaging the skin, right? It's controlled damage to the skin to force the body to heal. So you're getting a similar reaction without damaging the skin. CO2 Lift, CO2 gas, once it gets into the cells, it's going to feel like an injury to the body, but it's not injuring the body. It's allowing the body now to rebalance and start rushing that healing. That oxygen is going to open the capillaries, rush the oxygen, which comes with the hydration, which comes with the nutrition, which is going to now expand the capillaries to get rid of the waste out of the skin. You see? So that's why now when you said the best case use for that really is, it depends on what you're looking for. This, for wound healing, is perfect. And
Right.
anything that has wound healing capabilities has also an aesthetic benefit. So you think about if you want to heal a wound, this can actually close a non-healing diabetic ulcer in as little as 8 days.
Yeah, I've seen some of the photographs in your pamphlet and your material. It is quite remarkable where you're seeing open sores that look painful to view. And then after the application, you're seeing that healing, the skin is growing. What is it in this carbon or carboxytherapy that rejuvenates skin? Is it a new science or is this an age-old science?
So it is age old.
Okay.
It is age old. So as I said, it dates back to when people would go to the carbonic hot springs to deliver that CO2 gas, and it would penetrate into their skin because skin is the largest organ, so it would penetrate into the body. Then the French developed to where they would use a gas, so a tank of CO2 gas connected with a needle and put it into your body.
So injecting CO2 gas into your body, actually the feeling of that is painful. You'll feel the pain.
Yes, it's a little uncomfortable, and then there's some swelling
Sure.
that's associated with it. But then there's a benefit. So this now is when you put these two gels together, it creates the CO2 gas, and then the patented formula holds it into the area that it's there. So if you think about it, many people think of CO2 gas, you think of when you drink soda, for instance, that's a CO2. You think of something bubbling, and you'll see now, especially now, the CO2 is very popular. We've educated people. You'll see other so-called carboxy that will bubble on your skin.
Okay.
How do you know that that's not true carboxy? Because it doesn't reach to the muscular level. So CO2, just like in your blood, our blood is not bubbling, although CO2 gas in it. That's the magic of the CO2 gel. It's the pH. So
Okay.
it's allowing you to put it on your skin to the most sensitive areas. It doesn't harm your skin, yet the CO2 gas is going all the way to the muscular level.
Okay. So in this particular box, it says standalone minimum of 3 treatments every 5 to 7 days. So what would be the standard procedure for someone who is just looking at this for anti-aging purposes?
Okay, very good. So we've invested heavily in studies on this, clinical studies. We're very big on that, and they're published in peer-reviewed journals, right?
Okay.
So for instance, for just anti-aging, one of the biggest things that causes wrinkles is lack of hydration, right?
Okay.
I always say you don't get old, you dry up. And I always give the analogy of a grape and a raisin because I think that's a visual depiction of aging. We are born this beautiful grape, and then we turn into this raisin. Right? So we can slow that down with something like this because one of the things it does, it increases hydration 117% after one application. So you ask the question, how soon do you see results? You can see it immediately because especially if your skin is dehydrated, you're going to think of getting that raisin and almost putting water in there and it filling out again. That's kind of the feeling you get. But I think more importantly is what it's doing under the skin. So another factor in aging is the loss of elasticity, right?
Correct.
So there's really nothing on the market to date that you can put on your skin that's going to increase elasticity to this degree. For instance, you'll see products and it will say increase in elasticity, but they can't really give you a number because it's small. This, after only 6 applications, it's 26% increase in elasticity. That's a very measurable, significant amount. So if you think about anti-aging, you want to increase elasticity, you want to increase your hydration, you want to bring your own exosomes, your own growth factors to the area. That is what this is doing. And it's doing that, and the results are extending beyond the 45 minutes that you have to keep it on.
Yeah, I love the fact that in certain other anti-aging procedures, I did the comparison to Morpheus as an example. It's painful. You're penetrating the skin. That you're blistering the skin, you see blood. This is non-invasive,
Correct.
Which I love, and also with those types of procedures, the radiofrequency, they say it boosts collagen. That's the same effect that CO2 has when it's because our skin's permeable.
Yes.
So somehow this formulation is creating the carbon dioxide to get into our skin and having the same effect as an invasive procedure, but it's non-invasive.
Correct, because as you said, the skin is a great barrier, so it protects us. So, for instance, a lot of other, say, biostimulators. For instance, if you use exosomes, it can't really penetrate unless you break the skin barrier. So you have to break the skin barrier, put it on, and then it will penetrate.
Right.
The CO2 is getting into the dermis, right into the muscle without breaking the skin barrier.
Right.
And that's the magic of it. So think about doing a medical procedure at home that is getting that effect, that deep effect in terms of rebuilding the skin, rebuilding the tissue, as well as giving you the outside visual aspect very quickly. I just think it's remarkable.
Yeah. Why doesn't everybody know about this?
Well, this is what we're doing right
now. This is what we're doing. It's like the secret to skin in a non-invasive way. It's like, give me 18,000 boxes of these. That is amazing. I want to move on now to something I'm very excited about. And I'm excited about it for many reasons. They have got this product and created a formulation for the vajayjay area.
Yes.
And this is important because there's a lot of women who experience a lot of discomfort and a lot of shame or embarrassment and or like concern over their, vagina, the aesthetics, the pH, like all the things. What is this and how did this get created and why did I just learn about this today?
Well, I think one of the reasons, first of all, I love that we're talking about this. I think one of the reasons we're just hearing about this because we as women don't talk enough about what happens to our vulva as we get older. I mean, we think of, our face.
We see what happens to our vulva. We just don't talk about it.
We just don't talk about it. And vulva, vaginal skin is very similar to the skin under our eyes. So as a woman, if you look at what's going under your eyes, trust me, that's what's going on down there. I've heard, from a gynecologist often says, you look into a vagina, you're going to tell a woman's true age. So
now I'm going to look at women's eyes and go, is that what your vulva looks like?
I know, right? That's what's happening.
Oh my God, give me eye patches right now.
But I think the more importantly than the aesthetic is the functionality. And for us as women, sexual intercourse is more than just having children. So we want to enjoy it. And one of the things that we don't talk about is how we as women enjoy it is the fact that it's not only the vagina, but the vulva has a lot of pleasure for us because it's in our clitoris. And one of the things with the clitoris is that it needs blood flow. Okay. It needs blood flow to get engorged. And, like from the time we're 25, just like we start aging on our face, we start aging down there.
Well, like this says, the box, okay? You got me at V, okay? It says Carboxytherapy Vaginal Rejuvenation Treatment. Is VRT something that existed in the beauty space? Like, did you know about that, or is this something you create?
Well, this is definitely a new creation. This is the first vulva vaginal carboxy treatment that's doctor approved, physician approved. So if you go to your physician, you can ask them about this. They recommend it for women just after having children. You know how when you have vaginal births and the swelling that takes place and you have to go into the sitz baths, you think about that. Well, this is something you can use to replace it.
You're giving me nightmares.
you remember that time?
I remember.
Oh my God.
When I gave birth at my hospital, they had they'd given me pads that were frozen, so they filled it with water, and so I'd have to walk around with a big bulky frozen pad to help with the swelling of my vagina. And I remember looking at my vagina at my first birth, and I was like, is it ever gonna look the same ever in my life? And I was thinking of my husband at the time. I never want him to see this. I can't unsee this right now. I can't unsee my vagina. It looked like the end of a UFC fight when you're all bloody and engorged. And I was just like, my vagina's never gonna have any pleasure again.
Well, if you ask your husband, he doesn't care. They just want to get back in.
But I did.
They said that men come out and they spend their whole life trying to get back in.
Yeah.
But the vulva, this can be used to reduce the swelling down there for the vulva, and then also for the
post-birth.
So they use.
Oh my God! Every hospital needs this.
Immediately post-birth, a woman can start using it. It's very cooling when it's applied, but it's going to start reducing that swelling. But I think too, it's going to reconnect you with your vulva vagina, because they say to wait 6 weeks and then you can resume. And oftentimes, I remember myself, I wrote my doctor, who is a good friend of mine, said put another 6 weeks because I'm not ready for this. But this would actually reconnect you very quickly because all the trauma that goes down there after childbirth, you don't feel the same way. This kind of gets you back, centers you back into your womanhood very quickly. So it's going to help with that.
Have you ever heard of that phrase or that new thing where they said men have to give women a birthing gift?
Yes.
This is it.
Yes.
Okay?
Yes.
At the baby shower, I want 10 of these. Okay? I want to prepare my vulva and my vagina for the aftermath of birth. Vaginal rejuvenation treatment. I've actually seen, you know, and I'll post this in the video and some links, some before and after results of an aged vulva, right?
Yes.
Because every part of our body as we're aging, unfortunately, goes through some of that. So you lose the elasticity. You lose, it looked a little bit flat, so to speak. And then was that after a 5-day treatment that it looked full and more
One was after
engorged?
5, and one was after 10. I don't know which ones, but so the minimum that you would really want is a 5 count. You want to start, if you've never done any type of vulvovaginal rejuvenation, you want to do 5, and you would do it every night for 5 nights. And there's no downtime. But I wanted to step back, Carmelia, because when we talk about this area, of course, women are sensitive about what you put in. We spend all our life, you know, you hear all the time doctors say, don't put anything inside, don't put anything inside. Well, guess what? There are some things that you need to rebuild that tissue, and this is recommended. So our first clinical study that we've done, and we've done 3, 2 of them have been published. We're in the process of another third one now. But when they did it, it was double blind, which means that the patient didn't know if they were using the CO2 Lift fee or they're using just an ultrasound gel. And they had to fill out a sexual questionnaire, which measures desire, lubrication, orgasm. The women that used the ultrasound gel showed no changes in any area. The women that used the CO2 Lift V showed significant changes in all lubrication, desire, orgasm.
So what did the women think that they were putting on their vagina? Did they say that they were going to be putting on some kind of treatment that will help to improve or enhance not only their sexual function or sexual desire? There were going to be other benefits that they were meant to note by putting on this cream.
All of them thought they were receiving that.
Okay.
So the half of them, in the 20 women, 10 didn't receive it. But they said this didn't help me, but they didn't receive it. They received an ultrasound gel.
Got it.
And then
just like that gel when for women, ladies might know, some men may or may not know, but it's like imagine putting Vaseline on your stomach, like there's
so
no
they thought, and then you think even the placebo would make them think desire, but the ones that they showed no changes did not receive the CO2 Lift.
Okay.
The ones that showed significant changes received the CO2 Lift. Then they did biopsies. So they did biopsies on the women that did the CO2 Lift. After 10 treatments, that tissue looked remarkable. It looked like they were in their 30s. So not only was there a clinical response, but now you can see from the studies that this really is happening. You know, the science behind it. And then, of course, I tried it the first time, and I'm telling you, Carmelia, it's so great how God makes this happen. We don't get old in one day. We don't feel old in one day. It's so gradual. And it's the same with down there. You forget how good it felt. It could feel. And it was just remarkable. And I thought, oh my goodness, I have to give some to my mom. So my mom and my aunts got it. And they went from sandpaper to butter.
Oh my goodness!
So it was just so we knew we had
Excuse me, I have to go to the bathroom.
we knew we had something here. Yeah,
I need some butter in my vagina. This is great.
It's amazing. So not only for women after childbirth, but women getting older, women wanting to prevent aging. It's something that we as women need to start taking care of and being aware of, and telling our daughters about the fact that this happens, and how just like we train them on how to take care of their skin on their face, it's skin in between the legs is, to me, even more important.
I can tell you as a matchmaker and as having a long-standing career in the dating relationship industry, women have a lot of concerns and insecurities about so much of our outer body, right? Let alone going down in our private areas. I think there's a lot of anxiety around what our vagina should look like or what it should feel like in sexual function. I don't think we're talking enough about this. So I'm really excited to share this, and why I'm passionate about talking about it. And I think there's no shame in exploring ways that you can improve sexual function and ways that you can improve the aesthetics, because the more comfortable you are with your body, what it is, what it isn't, the more pleasure you can get, because you're no longer thinking, oh, what's he gonna think? What am I gonna think, right? So what are some of the results that you've seen from women?
So we've had, when I tell you, we have so many testimonials that come in. One of the things, one appeals to, I can think of one. She was 28 years old. So you think of a young woman. I mean, before I'm thinking of someone in their 50s like myself. 28 years old. She did not have sex until she was married. And when she had sex, it was very painful for her. So she had PCOS. And this
share with PCOS.
PCOS, it's, oh gosh, I don't remember the whole medical, but it's
what are the symptoms of PCOS?
So dryness.
Okay.
It can be, and painful sex.
Okay.
So she started using it. I actually have, you can YouTube this because Google this on YouTube.
Yeah.
Her testimony is there. After using it, not only her husband thought her young vagina or vulva was prettier, but she started feeling good about sex. I think too, it's not only that, as you said, because the mind is involved, she expected sex to be more comfortable, and then it was, so she enjoyed it. That was one. But another story that really stands out to me is a woman, she actually works for us now, but she had cancer. She had breast cancer, had gone through chemotherapy, and just because of the radiation and the chemo, it destroys your vaginal tissue, so it's very thin, so you bleed in sex. And she was newly married. So can you imagine? So her doctor recommended this, and she said that her vagina worked better after using it than it did even prior to cancer. So that was
an anti-aging cream for your vagina. Who would have ever thought of that?
Yeah.
Thank you for thinking of that.
Well, we have to look out for us women,
Yes.
Yeah.
Absolutely. So where can women and men have this? Because I think this is the gift that keeps on giving. Okay. And it gives confidence and comfort and all the other things that you're talking about. So I think it's fantastic. This is no longer just available to physicians.
No,
right?
correct. They can go to the website.
Okay.
And they can purchase it, and we can offer it.
Yes. And I'll share my link.
Yes.
And this can get delivered straight to your home in this beautiful box, in the privacy of your box. And just so that they can get a sneak peek, I'm going to be trying this. So I'll do my own, not even experiment, I'll share my own results. Maybe won't show my photo, but I will share my results. So it's the combination of this, this ingredient and the small package, mixing it up, and then what I like about this and the applicator, I will say, because sometimes people are intimidated by applicators. This looks pretty simple. I mean, I think this should fit most every woman.
Yes.
Right? It's about the size of a tampon.
Yes.
And it can go inside as well as outside. Right? Okay.
So they want to put most of it inside, and then the rest on the vulva to the perineum. It can even go inside of the anus.
Okay.
So it's really for that area. You have all of that, erectile tissue down there that you're simply activating. And it's going to really, and even if it's not just about sex, I mean, obviously sex is to me a big part of, in a relationship, it's a big part of connecting with your partner, connecting with yourself, but it's just simply about taking care of your womanhood, feeling good. Some women have burning vulvas, burning vaginas. So why not just feel good about it? And it's a comfortable treatment. It makes you feel sexy. It makes you feel positive. It makes you feel confident. And I think those are key factors in performing in every aspect of your life.
I love that. And it's not exclusive to older women, senior women, women after childbirth. I mean, this really applies to all women. I know women of many ages deal with lots of different issues, from dryness to itchiness, childbirth. So this is amazing, and this is the reason why I wanted to bring you on to showcase. We'll be back because I want to talk about my results and my experience, both on my face, my neck, and on my own area. We'll talk about that. So where can our folks reach you if they have any further questions?
The best place, I think, is Instagram.
Okay.
Instagram, we're at CO2 Lift, as well as we have another one at CO2 Lift V. And our support team is very responsive. Also, you can go to the website, call us. We'll answer any questions for you. And you can email support@CO2 Lift. All the information is on the website. But we want to help you, want to give you more education. And if you Google us or put in CO2 Lift, go on YouTube, you're going to find a lot of information, not only from our team, but from a lot of the physicians who recommend it, and their patients are benefiting. So you can get as much information there.
Well, thank you. And we'll be back, I don't know, I guess in next week. It'll take me 5 days, right?